The pandemic is proving to be a marathon and not a sprint, with resolution feeling miles and miles away. Maria Torres, a licensed clinical social worker and behavioral health consultant with Saltzer Health, reminds us why taking each day one step at a time is crucial to our mental well-being. Maria, COVID-19 is obviously causing a lot of stress and anxiety in people. What are you seeing in your patients?
So we've seen a big increase in anxiety and a lot of the other behavioral health issues as well, but mainly in anxiety, both on patients that maybe had struggled with it in the past, but also in patients that didn't have a history of it before.
Okay, and what are some of these signs and symptoms that people really need to look for, especially since you're saying some may not have a history, so they may not be as familiar that there may be things that are arising?
Yes, so some common symptoms of distress or concerns that we look for are when patients are feeling angry, sad, they're having fear, numbness or frustration, changes in appetite and energy and in activity levels, when they're having difficulty concentrating or making decisions, any difficulty with sleeping or when they're having nightmares. And there's also physical reactions, which are often forgotten or really not paid attention to, but headaches, pains in the body, stomach problems. Also, when your chronic health problems are worsening, or when you're starting to increase the use of alcohol, tobacco, or drugs.
At what point should somebody contact a provider?
If you're having some of these symptoms and behaviors that we talked about for several days or weeks in a row, and you're not able to carry out your daily activities or responsibilities because of them, then that's when it's time to call your provider or your doctor.
Okay, and then help us with a little bit of preventative medicine here, if you will. How do you suggest that people take care of their mental health? What can we do to avoid these red flags and be at our best?
So starting with the basics, getting a good night's sleep, getting good nutrition, getting your physical activity and having a routine, but also staying connected while following guidelines, obviously, with family, friends, and people that you normally socialize with. Staying informed with credible sources, so that's important. Giving yourself downtime to be able to just kind of let go of things for a little bit, and avoiding complete isolation, avoiding oversaturating yourself with news, just not really resorting to tobacco, alcohol, or illicit substances to cope with stress.
Okay, and where can people go for information and for help?
So they can go to saltzerhealth.com for more information, and in there you will find some national and local resources.
Wonderful, Maria. Thank you so much for helping to keep us well, not just physically, but also very importantly, mentally.
Thank you.